Hey folks, good morning. How's everybody doing today? So we're going to talk about what you can do about sciatica. And if you don't have sciatica, what you can do to keep from getting it. I mean, nobody wants to get sciatica because it's a pain in the butt, right? So before we get started though, who am I? I'm Dr. Timothy Harcourt, practicing 33 years, neuromusculoskeletal medicine. And we're here to give you the DIY, do-it-yourself things for sciatica. Now listen, if you don't have it, let's not get it because it's not much fun. So we're hopeful this video reaches out to those of you who might have a pain in the butt. We'll help you get rid of it. So what kind of things can you do? What kind of things? And by the way, if you know of somebody suffering with back pain, they have pain in their butt, it starts in their lower back, goes down their leg, send them, tag them. And also put in the comments any new topics that you'd like to go over. I believe this is our 6th topic. Next week we're doing fibromyalgia, which was a huge one. We've had a lot of people ask about fibromyalgia, and they want to know what can they do about it. Hey, have a sip of coffee. That's what this is all about this morning. It's an opportunity to sit down with you. A lot of times when people are coming in, we don't have this type of time or amount of time to chat. So we're going over the things that you can do to keep yourself from getting sciatica, or if you have it, to help get rid of it. And good to see you today. What kind of things can you do? Well, first of all, you can do self-care. Okay. Now, what do we mean by that? What are the things that you can do at home? Well, let's talk about what causes sciatica. A lot of times you're looking at somebody took a long trip in a plane, train, or bus, and they had a lot of axial compression on their spine. That axial compression leads to nerve irritation. And if I can bring up the actual slide on that, that would be awesome. So we're going to see if we can switch. Okay, so you can see the diagram up there and the arrow pointing to it. And that area is known as the piriformis, that red muscle that's overlying that yellow nerve right there. A lot of times that's actually what gets irritated. Now it could happen, and you can see down below at the spinal level, can happen at the spinal level as well. So that's one of the things about sciatica. It can happen in more than one place. It's kind of like a water hose. If you pinch it one time, you'll still get some water through it. If you pinch it twice, you're not going to get a lot of water through it. Now in this case, we want the electricity to get through the nerve. In case you don't know it, I mean, the sciatic nerve is the size of your index finger. That's a large peripheral nerve. In fact, it's the largest peripheral nerve in the body. And when it gets pinched, it lets you know, because that hurts. You know, at that point in time, it's time to back the truck off the garden hose. So what can you do to help get the truck off the garden hose? Well, first thing is, don't park it on the hose to begin with. And what do I mean by that? Well, you know, you have 12 acres of pasture to mow or whatever, lawns. You just don't do it all at one time. Break it up, take breaks. You know, give your back a break, do some stretches, do some exercises, get some water. Don't sit on your garden tractor for 8 hours straight. Doesn't make a lot of sense, because you get that compression and it irritates at the spinal level. And guess what? Your butt's sitting right on that nerve right there. So between the compression in the spine and the compression on the nerve going through that sciatic notch, you can definitely get sciatica. A lot of the sciatic patients we see, they came back from a trip up north. Maybe they were on a trip out west, whatever. They're in a car forever. That's a really good way to cause sciatica. But we can do it in everyday life too if we're not careful. So that's the idea of this session, is to let you know what you can do to reduce the chances of getting sciatica. So what are some other things that can be done besides self-care? There's some things that you can do on your own. Let's just see if I can bring that up here. So stretches. What are some of the stretches you can do? So the stretches are right on that muscle. And the piriformis muscle, you stretch it by crossing your leg to the opposite knee and point it towards the opposite shoulder. Now, you're not necessarily going to get it there. And by the way, we have this stretch. I demonstrated with the patient on our website and on our YouTube. So Coast Chiropractic Center's website and YouTube. So that's actually on there. So if you want to see a demonstration, just go on either our website or the YouTube and you'll see it. Needed chest stretches are also on there, and that'll get at the spinal level. So that's the other issue. You can affect a change at the spinal level by decompressing the nerves coming out of the spine, and then also what you do with that piriformis, you stretch it, and then when you're done stretching, there's less pressure on the nerve. That reduces the irritation to the sciatic nerve 2 different ways. So the 2 exercises I'd say on the website or our YouTube channel is needed chest stretches and the piriformis stretch. So they go a long way. The other thing is just don't sit forever and not take a break. So there's a lot of people doing internet consulting on their computer. They're sitting at their computer 10, 12 hours a day. Hey, take breaks, get up, move around. We weren't really designed to sit for 12 hours straight. That's not really how our body was designed. So the stretches go a long way to help reduce irritation on the sciatic nerve. What are some of the avoidances? So as we mentioned, prolonged sitting is certainly one of them. Long drive. So I have patients, they'll take a trip to Tallahassee or wherever 5, 6 hours straight and only stop maybe one time. Well, you might want to stop more often because that's going to reduce the chance of irritating that sciatic nerve. Make sure you're drinking plenty of water. That's a good one because our nervous system gets irritated when we're dehydrated. Not to mention the fact that we put ourselves at risk for a clot, blood clot, but it's just an irritant to the whole body because water is essentially what helps dilute the acids and toxins in our body. So you want to make sure you're drinking plenty of water. You want to avoid things that can cause irritation to the nerve. So what are some of the things that can irritate nerves? Well, way too much coffee. Now we're having 1 coffee this morning. We're not having 3 pots. Why? Caffeine stirs up the cells. I mean, it just does. And if you have an irritation on a nerve, it's going to irritate it. So stimulants can irritate peripheral nerves. So then what's the next thing we're looking at? The next thing we're looking at is anti-inflammatories, because really when you think about it, a nerve is inflamed. If we can reduce the inflammation in the body, it's going to help that sciatic nerve. So what are some of the natural anti-inflammatories you can do? A big one is non-THC CBD. Now the dosage is different for each patient depending on your body weight and how bad it is. Sciatica can be really bad. I mean, it can be a severe pain in the butt. I mean, let's just face it. We have patients that might have had it 6 months before they come in here, and that's no fun. Anything in the over 3 to 4 weeks now is considered chronic. 6 months is definitely chronic. So the problem with that is the brain learns that you should have pain in that body part, and even if we remove the noxious stimulus, your brain still thinks you have pain. That's a much bigger problem. That's called centralized pain mechanism, and we want to avoid chronic pain. So cytokine interleukin 6 causes chronic inflammation in the body. Non-THC CBD blocks interleukin 6. So that helps to reduce the chance of you developing chronic sciatica, for that matter, chronic anything in the body. So that's why CBD, non-THC CBD is a good idea for a lot of things. So those are some ideas for you. Basically, get off your butt, keep moving, drink plenty of water, take anti-inflammatories. And when I say anti-inflammatories, I don't mean chow down on sodium naproxen and Advil and all that stuff. Those medications have a negative impact on organs in the body. Sodium naproxen is particularly irritating to the GI tract, can cause ulcers and other problems. So ibuprofen is hepatotoxic, and you never exceed the bottle instructions there, obviously. So, but the thing is, if you can go with a natural anti-inflammatory, you're much further ahead. Like a non-THC CBD is great for helping you sleep better to begin with. So, somebody has sciatica, they have a hard time sleeping. So if we can normalize the nervous system and reduce the irritation on the peripheral nerve all at the same time, we call that a win-win, right? Now, I recommend staying away from the THC CBD. You don't need that component of it. It just isn't necessary. And why go down that road? Okay, we're all about keeping people off of addictive pain medications. I know there's a lot of research that needs to be done whether or not THC is addictive, but a case could be made that it is for sure. So why even go down that road? Just take your CBD without the THC, and that's the only product we sell here. We don't offer any products with the THC in it. So, and then drink plenty of water and take breaks from activities where you are you're bouncing up and down. It could be a drive in the car. It could be on the motorcycle. And by the way, we didn't talk about it in the plane. A lot of people think that you just have to sit there. You're not allowed to get up and move around. That's not true. Yeah, if they have the seatbelt sign on, you're supposed to try to stay in your seat. One of the strategies you can do is to pay the extra few dollars for an aisle seat. Then you can get up, even if you don't have to go to the bathroom, just take a walk down the aisle and back once in a while. By the way, that reduces your chance for a blood clot too. Blood clots are definitely something you got to be concerned about on a plane ride. First of all, people will avoid drinking water because they're afraid that they might have to go to the bathroom on the plane. There's two problems with that. One is you're dehydrating yourself, and the next thing is you're not getting up and moving around. That stasis in your leg combined with the dehydration can cause a blood clot. So we're going to actually spend a whole time just talking about reducing your chance for a blood clot. That's not for today, but that's enough for you to understand. Next week is fibromyalgia. If you know of somebody that should see this, little bit of a movie we did today, please forward that to them. We really appreciate you watching the video today. If you have upcoming topics you'd like us to cover, we'll do so. If it's something we're able to do. I think this is our 6th week. Next week will be 7. So you can look back on the other ones on rebroadcast and take a look at those. The one thing in preparation for this, I was thinking, one of the most important things for all of us to do right now is to be creative in our life. And we had a whole day where we just talked about creativity and driving your mental and physical health forward. And if you haven't seen that one, definitely go back and do it. So it's Dr. Timothy Harcourt. I'm signing out. Stay strong, stay healthy, and stay creative. We'll see you next time. Have a good day.